Hey guys, how you doing? This is Tom here. I just got done doing a 40-day survival course with Sigma 3. And I'm kind of getting ready to start some videos on YouTube, and I think my best way that I want to do that introduction is starting with some medical kits that I used while I was there. And I want to do a review basically on one of the medical kits that I carried while I was at Sigma, and then I want to transition in some of my other videos to some of the bigger kits that I carry that involve trauma kits and antibiotics and more of a long-term survival type kit. But on this video right here, I'm just going to do something that I carried out in the field and that worked for me. I was out there for 40 days with 13 guys, and this kit that I carried was something that's pretty much sustained all of us while we were out there. And it's a great kit. It's lightweight and it's simple. So I'm going to go ahead and jump into some of the products now that I used while I was out there. I started with this IFAK. It's really small and it's lightweight, and this is what I always start with is my PPE, which is my personal protective equipment, and that's these gloves. You always really want to glove up every time you use something. I've got two different types of tapes here that I use. I use a white one, and then I use a little bit of a stronger, heavier duty brown tape, and these can get picked up at your local store or Walgreens. This kit is really just some basic stuff. I've got some Coban, and then I have some Coban with gauze that I use, and a couple of Ace bandages here that I put in my kit. I've got some betadine and hand sanitizers, and I also have alcohol prep pads. These are really good. They're multiple purpose, and if you're out in the field and you don't have a way to start a fire, hey guys, you can use this sanitizer, and you can use your alcohol prep pads to start fire. I also have here some wound seal. I have two different kinds. And these are just basically a powder you put on your wound and it'll seal it up. This one over here by Curad, you can put it on and it'll stop the bleeding, and then you wash it off with some water and it'll turn into a scab. It's pretty useful. I have some second skin here for any type of blisters that you may occur, and different band-aid sizes. I really like these big ones because they can be cut down to size. I also have some sterile gauze, some Neosporin, and some hand warmers. I've got this Picot that you use for any type of indigestion you may acquire, or stomach pains, and you just put it in some water and you drink it and you're pretty much good to go. I carry some diphenhydramine, which is Benadryl, 25 milligrams, some ibuprofen, 800 milligrams, some acid reducers, some Advil PM, and just some regular Advil, 200 milligrams, some Q-tips, some anti-diarrhea pills. I carry some tweezers. I carry a little cutting tool here and some hemostats. You know, it's just a real simple basic kit, but if you need to stop the bleeding, it's going to do that. It'll fit in a small bag and it's easy to go. It's easy to carry to the park if you have kids. You know, anything that you need to do in little boo-boos, it's something very basic and very simple. Like I said, I'm going to be doing a couple more videos on some bigger kits and some trauma bags, and I'm also going to be doing and shooting some videos going down to Mexico on how to procure different injectables and how to do suturing and all that. And remember guys, you bring about what you think about in this world. Stay safe and stay ready.